Yes, sir. Good evening, everyone. This is Dr. Mansi, and I welcome you all in the Homeo Bridge 2026 webinar series in collaboration with Bhagwan Buddha Homeopathic Medical College. I am very happy to introduce our today's respected sir, Dr. Jayadithya, and we have Dr. Minakshi as the collaborator, as the moderator, and today we are going to learn about a very interesting topic by Dr. Jayadithya G. I would like to hand over the mic to Minakshi to introduce our today's topic and our today's speaker.
Thank you, ma'am. It is my privilege to introduce Dr. Jayadithya sir, the author of two published articles in Scopus indexed international journals with research focusing on the homeopathic approach to myalgia, and currently the assistant professor at Bhagwan Buddha Homeopathic Medical College and Hospital. He has specialized in organon of medicine, homeopathic philosophy, and fundamentals of psychology from Bharati Vidyapeeth Homeopathic Medical College, Pune, thus a doctor of medicine and philosophy. He brings with him valuable homeopathic insights, not just from the numerous philosophy books, but also as a physician from institutions including Tumkur District Hospital, Venlok District Hospital, Mangalore, and Community Health Center, Moodbidri. Sir is also a polyglot known for his humor driven lectures and dedication to teaching. He has actively attended state, district, and national level seminars and represented the RGOHS University in the state level NSS camp. Disproving the conventional idea of a typical medical life, his talents extend beyond just the classrooms and OPDs. He is a recipient of numerous accolades in debate, dance, talent hunt, and poetry competitions. On that note, we all welcome you, sir.
Thank you. Thank you so much for giving such a brief and a lovely introduction. A very good evening to one and all present here. So, I would like to begin my lecture or webinar with the fact that I would like to say that why is that I have chosen this particular topic, that is myalgia, is the fact that it is a little bit away from the conventional type of methods that we follow to treat this kind of diagnosis. So, why did I take my dissertation topic as today's webinar topic? Is because of the fact that the topic itself, you know, and the cases that has been mentioned in this particular topic is worth mentioning. Because the patients, first of all, I would like to say that were proper sports people that I had got as patients. Some were marathon runners, some were athletes, some were like relay players and everything. So the thing is, I wanted to do something regarding the sports medicine, but then later on, as the day, like the life progressed, they got into different jobs, and after that, it took they took time off from these sports activities, and from then on, the problem, or I could say the delayed onset muscle soreness, begun from then. So I was really interested to do something regarding this particular topic. Also, it was a post-COVID era. There were a lot of post-viral arthralgia and neuralgia and different types of pains related to prominent myalgia. Amongst all these marathon runners, I was able to witness. Uh, One of my sir who is in my during my PG period, who was kind enough to let me go on the grounds where sports people used to do their regular practice and workouts, and he allowed me to take their cases. And then later on, when I gave them medications, they were cured of the delayed onset muscle soreness or whatever the symptoms that they were having. But then I couldn't take delayed onset muscle soreness as a diagnosis itself because it's a symptom in itself and not a diagnosis. So I had to select the topic myalgia as my particular topic. So this is why I have taken some of the cases out of all the cases from the dissertation. Totally, I will be presenting 46 cases, but all the cases might not be like time permitting today. Also, we started late. So it will be difficult for us to complete all the cases. So I have prominently taken 6 master cases. And if time permits, I'll be continuing with the rest of the cases as well. So So shall I begin with the presentation, ma'am? Are you able to hear me?
Yes, sir, you're audible.
Okay. So technically, the role of homeopathy in the treatment of myalgia is my topic, and I will be presenting on this particular topic today. As we all know, let us spread some light on the topic myalgia. Myalgia is one of the most common clinical complaints. Are you able to see my screen?
Yes, sir.
Okay. So technically, this is the topic which I'm presenting today. That is role of homeopathy in the treatment of myalgia. And let us spread some light on this particular topic. It's a very short and brief introduction. Myalgia is one of the most common clinical complaints, affects athletes, corporate professionals, autoimmune patients, requires individualized approach for effective management. The objective of this particular study is to understand acute totality in managing myalgia. Now, again, why I have taken acute totality into consideration is because of the fact that whenever a person is suffering from certain diseases or disease conditions, whatever the symptoms the person presents as soon as they arrive in the clinical setup is the most annoying symptom which is seen in the patient. And there is a myth, or we can say uh, a preconceived notion amongst all the patients that homeopathy is only good for chronic conditions and everything. And for acute and emergency conditions, it doesn't really work well, is what we have heard most of the times. It has been disproved by so many other pioneers and legendary practitioners that have been working in the field till date. But then we are still behind ensuring the fact that we are able to disprove the myth regarding homeopathy. So that is the reason why I was very much interested in taking acute totality into consideration, and rather than dealing with it in a chronic way or in a timeline uh, which is of a greater length. So that is the reason why I took acute totality into consideration. And the objective of this particular study is to understand acute totality in managing myalgia. Now let us understand myalgia, like according to like what causes myalgia. Technically, myalgia refers to the muscle pain, either localized or generalized. So technically, the common causes you can see on the screen is the overuse and delayed onset muscle soreness, that is DOMS. As you must have already known, after the regular exercise or periodic activity that they do on a daily basis, which is scheduled for a particular sports runner or a marathon runner or a sports person or a person who regularly goes to the gym or does any physical activity, undergoes this type of symptom, which is called as delayed onset muscle soreness after 3 to 5 hours to 3 to 5 days, which is seen according to the body constitution, no matter how robust the constitution is. Next is the viral infection, like post-COVID viral arthralgia, we will get to see in enormous amount of patients during the COVID period. My dissertation topic was again during the COVID period. That is the reason why I'm mentioning again and again. Next is statin-induced muscle pain. You can see this in cardiac-related patients, and autoimmune disorders like rheumatoid arthritis. You will get to see interphalangeal pain amongst the people, especially stiffness during the morning. First 45 minutes of the day. As the day progresses, the pain also reduces. We must have seen in our elderly geriatric age group people. Here you can see another cause is electrolyte imbalance, which is very much important these days. All these gym freaks, all these people who are doing gym, taking proteins and different creatinine supplements and everything, forget to take the electrolyte, forget to maintain the electrolyte balance in the body, especially magnesium, calcium, potassium. Also, water intake to the body is very less these days because they ignore completely the fact that it is important for us to maintain the electrolyte balance within the body. Fibromyalgia and chronic fatigue is generally the cause for myalgia, because as you can see, every day when we are doing day-to-day life activities, we forget to think about the fact that we need to slow down our pace, because we can say like every day our activity is increasing day by day, and we forget to take rest, and we forget to take care of our own muscles, like say for example taking a massage for a day, taking a bath for a day, or something like that. Different types of salt baths are there. So we forget to take rest, and we forget to treat our muscles. So that is the reason why we will get to see this one of the common causes as well. Next is the psychological stress. Now this is the biggest cause these days. You can see there's a lot of stress amongst IT professionals and medical professionals, and also the people that are working under heavy machinery or artillery or whatever. So that is the reason why these are the common causes that causes myalgia, you can say. Next is the pathophysiological mechanisms: cytokine mediated inflammation, microtrauma in muscle fibers, central sensitization, electrolyte disturbances, and stress mediated HPA axis activation is the major reason why we will get to see how myalgia progresses further as a pathological, physiological condition. Okay. So next is acute totality
Why
in
is it
homeopathy. How am
here?
I? Yes, ma'am. Is everybody able to hear and see the presentation?
Yes, sir.
Okay. What was the disturbance about? Is it okay? Shall I continue the presentation?
Yes, sir. You can
Okay.
continue.
Acute totality in homeopathy has been considered regarding, like, see, for example, we take it as a details of presenting complaint, or details of chief complaints we will be taking according to the LSMC method, that is location, sensation, modality, and concomitants mentioned by bone person. So technically, we are talking regarding the location of the pain. We are talking about the sensation of the pain. We're talking about the modalities and concomitant symptoms. Then is the causation, that is the etiology, and then mental health is taken into consideration. As we all know, we do not have a separate column where in different systems of medicine we have this we consider cases into mental cases are different and physical cases are different, but we do not consider it in such a way in homeopathy. We all know that we treat the person as a whole and not according to the diagnosis, is what we say. But then as the day progresses, since we have upgraded ourselves as physicians these days, that is the reason why we will have to update the way we treat the disease. So that is the reason why acute totality has been taken into consideration when it comes to the matter of uh, this particular condition, and that is the reason why I've taken acute totality. Now, next we can see the clinical importance ensures individualized remedy selection, focuses on present dynamic symptom expression, allows measurable and structured case analysis. So this is what the clinical importance we get to see. Individualized remedy selection, as we all know, we select remedies according to the clinical signs and symptoms, and the different uh, uh, ways of extracting the totality of symptoms, which includes both physical and mental generals, and all the symptoms that has to be taken into consideration. Focuses on present dynamic symptom expression. Whatever the present annoying chief complaints are the ones to be taken into consideration, so that we can arrive at a simillimum, that is a specific individualized homeopathic remedy that has to be given to this particular condition. The first case we are getting into, this is my master case. These are the master cases that I'm going to present right now. So this is my first case. I have taken few cases into consideration when it comes to the matter of clinical cases. I have 36 cases which I will be presenting if there is time that is permitted, but then I would be presenting these cases first, and if the time permits, I'll be presenting the rest of it. So first case is very interesting. As per my knowledge, this is a patient who I have given titles to different cases because I wanted to recognize and keep this in mind, because I always remembered these cases out of all the other cases that I've taken. So the statin-induced myalgia that looked like polymyositis. Okay, so the patient profile that says 50-year-old male on atorvastatin for 3 years, gradual onset proximal muscle pain in thighs and shoulders, with difficulty in climbing stairs. Now, whenever we are having this particular scenario where the person is not able to climb on the stairs, it means that the person has been under the influence of any other medication that has been taken for any other cardiac issue. Because if the person is taking atorvastatin for like 3 years, it has to be taken into consideration. Next is I made the patient undergo the investigations. The creatine kinase, that is CK, was mildly elevated. Vitamin D borderline was low. ANA was negative. MRI showed inflammatory changes. So technically, after all these investigations that were made to be done, acute symptom layer I had to take on to the basis of what the patient tells me as soon as he enters the OPD. So this is what he said. There was this marked soreness as if it is bruised, as if it is being beaten. Worse from slightest touch and cold air. Cannot lie on affected side, better from warmth. And there is anxiety at night and fear of serious disease. So technically, if the person is not able to like climb on the stairs and is feeling legit bruised and is having soreness and he's having pain even with the slightest touch. The aggravation is from the slightest touch, and because of the cold air, the patient is not able to lie on the affected side as well. So he had to lie down only on one side, and he's better by warmth, by taking warm applications. He had this hot water bag, which he was using for almost 3 years. So that is the reason why I took only the symptoms that he mentioned into that fits into the acute totality, because that was the most annoying symptom in this particular patient is what I felt, and also the patient mentioned only these symptoms accordingly. So the acute totality, you can say the location is proximal muscles, sensation is sore and bruised, and modalities is worse from touch, cold, and better from warmth. That is the reason why I've taken this into consideration as an acute case. And then the remedy that was prescribed was Arnica montana 200C. I have provided the justification down there, which explains regarding why I have chosen this particular remedy, and that is bruised soreness, fear of touch, and the drug-induced muscular trauma, which is the picture of this particular disease. As we can see in boric, which we generally use to clinically represent like whatever the medicine that we are supposed to like give for this particular patient. You can see these symptoms, and then for the follow-up, I would say that the patient came up with a lot of relief. By the way, we have stairs back in Bharti Vidyapeeth. So the patient climbed the stairs properly, came back. There was 60% relief in 2 weeks, and the CK was normalized, which was the biggest success I would say that I have ever seen in my entire career when it comes to the matter of this dramatic reduction in the amount of symptoms, I would say. So this case is what I feel you can see on the right side. The fear of illness, which is presumably seen in Arnica montana, is the biggest reason why I gave this particular remedy. Now let us pass on to the next master clinical case. This person is a 28-year-old female. Again, I have given a tagline for this particular case as well so that I can remember this for a lifetime. Post-viral myalgia with central sensitization. So this female, technically her profile suggests that she had persistent diffuse body pain after viral fever 2 months ago. As I already told you, this was taken during the post-COVID period in around 2022. So she was suffering from this particular persistent diffuse body pain, like all over her body. It was generalized, but specific parts were affected. While she was complaining regarding her body pain, she always told me one thing. She had a burning muscle pain, which was a very characteristic feature, is what I felt to be taken into consideration in this particular case. And she was extremely hypersensitive to touch, which is again another, a very particular symptom to be taken into consideration. Now, whenever a patient comes to you, they allow the doctor to touch, especially they like it when the doctor touches and examines the particular case. I was going to examine by taking her consent, but then she gave me the consent and she's not allowing me to touch. She was extremely hypersensitive to touch, especially in her knee joints. So when it comes to the matter of these particular conditions, I was really bothered to on to what should I consider. So that is the reason why I asked her to get her investigations done. Her ESR was mildly elevated, and creatine kinase was normal. Now, when the ESR is a little bit elevated, I wanted to go further with the case to know what is the exact reason and what is the pathophysiological condition that is going on. But then, when I asked her, she was better by pressure. There is some sort of an emotional vulnerability with weeping. In this case, I would like to say there was a flip of a second when the patient is expressing she is weepy in disposition, but when she enters the clinic she's all jolly and she's smiling and she's welcoming and she's very warm. She has a very warm smile on her face. She's talking to me and she's asking my halchal, like how am I and how am I doing in life and everything. She's very she'll get me something, like some fruits or some sweets or something like that. She's very um, I would like to say her spirits were very normal. But then, as soon as she starts to talk about her condition, she is very weepy and she shows her emotional vulnerability and she's ready to express herself, her sorrows, her joys, and everything. So, taking that into consideration and also the burning muscle pain, and since the ESR was mildly elevated as well, and she was extremely hypersensitive to touch, and that is the reason why I considered that this would be better to take acute totality into consideration again, since the most annoying symptom was the burning muscle pain. So then the sensation was burning, modalities was worse from cold, better by pressure, and mentally she's extremely sensitive but weepy in disposition. You can see there is a flip over within, like a changeover within a second. She is extremely happy, warm, and welcoming, and suddenly she is weepy in disposition when she is explaining her clinical signs and symptoms. So I thought and thought and thought and repertorized and got to know that this is nothing but phosphorus 200C. And the justification for this particular remedy selection is that the burning pains with emotional sensitivity and heightened sensory response. And the follow up, the patient came with again a very dramatic change in the symptom. The pain score, by the way, I might have forgotten to tell, I used numerical pain rating scale to measure the pain score before and after the treatment. I'll be showing you later the statistics of this particular data or the dissertation that I have done. In the follow-up, pain score reduced from 7 to 2 in 3 weeks. The sleep had improved within the patient, because whenever the patient comes with any sorts of pain, muscular pain or whatever, they generally complain about disturbed sleep because they are not able to sleep or lie down on the painful side or painless side or whatever. The sleep is generally disturbed. The improvement of the generals was my main motto. And then later on, whatever the symptoms that were there, if the specific similimum has covered the totality, then it will do its magic and wonders within days. So that is what I wanted to prove through this particular dissertation. Next is the case. Again, severe DOMS with electrolyte disturbance. You can see this is a 19-year-old male gym enthusiast with intense calf cramps post-workout, history of dehydration. This is a very common complaint, I would say, these days, that people tend to forget the fact that they do everything for their body, and but they forget to go with a particular trainer that suggests you how to do it, when to do it, and where to do it in a right way. So technically, he is into all these supplements. He takes protein supplements, he takes creatinine supplements, and he's doing all the high intensity workouts and everything. But he forgets to take his electrolyte, forgets to keep his electrolyte balance in check. So this is the main reason why this is one of the cases that was another interesting case for me, which represents this 19-year-old, a teenager who is trying to make a great body, but forgets the fact that he has to maintain his electrolyte balance. So he comes up with cramping pain, which was better from warmth and pressure. Worse at night, and restlessness is seen in this particular patient. Lab findings, as expected, it showed low magnesium. We all need to remember, whenever there is cramps in muscles, especially in calf muscles. It is because of low magnesium and also sometimes low potassium as well. So I told him to take few post-workout and pre-workout meals, say for example, with the help of brown bread, with a Nutella on a layer on top of it, and then few banana slices, which would help him regain that potassium and magnesium because banana is rich in both these minerals. So that is the reason why I told him to do that along with the medicine that I had prescribed. Since there is a cramping pain, better from warmth and pressure, worse at night, and there is restlessness, the remedy prescribed was one of our most magical, what to say, um, remedies, magnesium phosphorica 6x and 200C later on. When he started progressing, I told him to take it in a particular fashion, and that is dissipating these two globules of this particular magnesium phosphorica 6s into the warm water, which is quarter the tumbler, so that he dissipates this particular globules and takes it within 15 minutes after few twirls or succusions that he has given, which helps in dissipating the the medicine better and helps it dilute and helps it act faster, I would like to say. So the justification of this particular medicine to be taken into consideration is spasmodic cramping pains relieved by warmth and pressure. So that is the reason why I gave this particular remedy to him. As we have this 12 tissue remedy. This is one of the remedies. This magically works on different types of cramps and spasms of muscle, which in the further case, I have added a video which I have made so that you can understand how the muscle mobility and muscle contraction and muscle relaxation works. We'll see that in later cases. The follow-up, there is significant relief within 48 hours, which was seen very dramatic result again. That is the reason why I've taken these 6 cases as master cases into consideration, to the fact that it is to be taken into consideration because there was a dramatic response to whatever that has been medicine that has been given. Now, many of the people might wonder like, why is that I have taken management into consideration to this particular patient and why not other cases? Is because of the fact that sometimes the indisposition that occurs within the patient also plays a major role, is the most annoying symptom to the patient himself or herself, that they do not understand that this is just an indisposition. It can be uh, done in a proper way just by fixing the diet and regimen or the lifestyle that they are following on a daily basis. So that is the reason why, as doctors, not only giving the medicines but also suggesting them the general management and different sorts of management that can be told them so that they can inculcate onto their lives on a daily basis. Okay, so next in this. Okay, now as I told you, this is the video that is to be presented. You can see this particular video. You will understand how the muscle mobility and muscle contraction and the muscle relaxation work using the ATP molecules. So I'll play the video. I hope you understood what we could see in this particular video. So technically, this is what I wanted to share with the help of this particular video where you can see. Were you able to hear the audio of this particular video that I had presented?
No, sir, the audio was not audible.
Hello.
Yes,
Hello.
ma'am.
Yes, actually. So
Uh,
is sir is sharing any screen?
no, ma'am, he's not sharing right now.
Just give me a moment. I was trying to put the video again so that you can like hear
Okay,
the
sir.
audio. So I
Okay,
was
sir.
trying,
Sure.
yeah, yeah.
Sir, there is no audio.
Time you move, billions of microscopic motors fire inside your body. What you call muscle is actually a bundle of tiny fibers. Inside each fiber are even smaller structures called myofibrils. Zoom in further and you will find the real engines of movement, actin and myosin filaments. When your brain sends a signal through motor neurons, calcium floods the muscle cell. This unlocks the myosin heads. Now the real action begins. Each myosin head grabs onto action and pulls. To release and pull again, it uses energy from ATP molecules. ATP binds, the myosin head resets, then pulls again. Grab, pull, release, reset.
So in between few minutes earlier, the audio was there.
Uh, Nothing, ma'am. There was a technical glitch while presenting the video, and that is the reason why it created a lot of chaos. But then I'll just give you the gist of whatever the video was, and I'll just move on.
Okay.
Technically, like every time you move, like billions of microscopic motors fire inside the body. What you call muscle is actually a bundle of tiny fibers inside. Each fiber are even smaller structures called myofibrils, which are present in our muscle. If you zoom in further, you will find that the real engines of movement are actin and myosin filaments that are present in the muscle. And when your brain sends a signal through motor neurons, calcium floods the muscle cell, and this unblocks the myosin heads. Now, the real whatever the action that is going on within the muscle begins when the message has been sent and when the myosin heads are unlocked. Each myosin head grabs onto the actin and pulls to release and pull again. It uses energy from ATP molecules that are present. Then ATP binds the myosin and head resets. This makes another pull action again. That is the reason why it gets pulled again. Then there is a grab, pull, release, and reset action that is going on. So millions of these microscopic cycles happen every second, shortening the muscle fiber, which helps in muscular contraction. This is nothing but muscular contraction. When the signal stops, the calcium is pumped away, ATP breaks the connection, and the muscle relaxes. This constant cycle of contraction and relaxation is what allows your muscle to create mobility, strength, and movement. Okay. So every step we take and every weight we lift, and which is powered by trillions of ATP driven molecular machines working inside our muscles. That is the reason why we are able to do different actions using the muscular tone, helping with the muscular mobility. That is the reason why I presented that video. And maybe because of the technical glitch, you were not able to see or hear the video. So I gave you the gist of what was the video about. So technically, we will move on to the next case. This is the fourth case, which is the tagline: IT professional with trapezius myalgia and suppressed anger. Now, this is very important. I have the reasoning for everything. We'll just go one by one, take step by step. First, I targeted what the person complained about as a clinical, what to say, chief complaint that she came up with. So he came up with, he's a 35-year-old male working long hours at laptop. So we know what is the condition when somebody is in front of the screen for a very long period of time. They work ridiculously for like 12 hours, 12 to 18 hours, which is beyond repair. But then this patient came with the presently complaint of that only. But then I stretched further, asked him what is his actual complaint. That is when he actually told me about what was going on for a period of time. And that is stitching trapezius pain, worse from the slightest motion. Wants absolute less rest. He came up with the mental symptoms as well. He was extremely irritable even while explaining the case. Thirsty with dry lips. He had chapped lips. And I asked him what is the reason why he's always thirsty. He keeps on drinking water and nothing quenches his thirst. So the initial remedy that I thought the moment he complained about all of this is Briny alba 200C. And the reason why stitching pains was worse from motion, better at rest, irritability with thirst. Now, technically, when I resurfaced and researched the case again, uh, we found out that it could have been better if the remedy was alternated with something else. And that is when I referred to a book which was written by Dr. Constantine Herring. As we all know, he has written in his The Guiding Symptoms, which I have adjoined here. After that, I came into conclusion that it can be alternated with rustoxicodendron 200C. Now, the reason being, as I told you, it was worse for motion and then better at rest. And the person was irritable as well. And also he was thirsty. So I thought that Rustox would fit this particular criterion better than Briny alba as in such. So later on, after learning the acute totality that changes, the remedy must follow symptom evaluation. So that is the reason why I gave this particular remedy alternating with the Brainia alba, which was already given prior. So as I told you, this particular remedy was given. Yeah. So as you can see here, this is from the manuscript which has been taken into consideration. This is from the source note which says when bryonia fails or the condition changes so that the patient becomes worse from rest, better from motion, the remedy often changes to rest toxicodendron. So this you can read it in the book, The Guiding Symptoms. The clinical observation describing the change of remedy from Bionia alba to Rustoxicodendron is attributed to the German-American homeopathic physician Dr. Constantine Hering, 1800-1880. The concept appears in the discussion of remedy relationships in his monumental Materia Medica work, The Guiding Symptoms of Our Materia Medica. In classical homeopathic practice, this observation illustrates the contrasting modalities of two remedies. Bryonia alba is typically indicated when symptoms are aggravated by motion and relieved by the rest, whereas rustoxicodendron is characteristically indicated when symptoms are aggravated by rest and relieved by motion. When the clinical picture changes from Bryonia alba to the rustoxicodendron state, practitioners historically considered a corresponding change of remedy. Now, this is the reference that I've taken from the manuscripts of the book, which is written by Dr. Constantine Hering, The Guiding Symptoms of Our Materia Medica. So, this is what I wanted to say in this particular case. That is why I have done this changeover when it comes to the matter of the remedies that shifts according to the symptom similarity. So, yeah. Now you can see here, as I told you, I had mentioned regarding the suppressed anger. Generally, the blocked aggression you can see symbolizes raw restrained energy, muscular tension builds, represents tightening stress buildup, and then bottled up energy suggests trapped vitality, unused force which is trapped within the body, which causes inflammation and pain, which is neutral tone for physical suffering. This suggests, which is suggestive of where the patient goes into auto aggression, and auto aggression, which is a dark tone to show the inward directed harm. So the patient becomes more self harm inflicting. So he tries to harm himself or he tries to harm others. This is not a very proven theory, but aggravation that leads to pain pathway is what this layout is suggestive of. So it is a very vague representation of how it can be represented within a human being by explaining pathophysiology, but it is an observation made by billions and trillions of physicians amongst all these street fighters and boxers and all these people who are into sports the majority of the times. Expressive aggressive people are usually engaged in sports to release their aggression or bottled up emotions. That is why in this particular patient it was suggestive of this particular remedy that was given to him, because a lot of suppressed hidden anger. But then, since the more annoying symptom which was presented by this patient was something else, that is the reason why I taken that as an acute totality or a chief complaint as a consideration. And later on, if he comes again to my clinic complaining regarding the suppressed anger and all the constitutional issues, I would have given him a different remedy. So that is the reason why I wanted to show this through this case to the world so that one can understand how a suppressed anger harms or helps our body land up into different sorts of self-harm or harm that can be done to our body in different ways possible. Okay. So next case is the fifth case, that is fibromyalgia, like myalgia with chronic layer. Here's the patient profile: a 42-year-old female, widespread muscle pain for 5 years, suffered from IBS, irritable bowel syndrome, and migraine history. Now, again, as I told you, since I take acute profile into consideration because that is what they complain of as soon as they enter the clinic, the most annoying symptoms that was taken into consideration as chief complaints. So the symptoms were worse from cold and damp weather, better by heat, exhausted yet sleepless, anxiety about health. Now, very particular symptom of this particular case was that it was suggestive of me to give this particular remedies because of the fact that the patient was telling me that even though she was exhausted, she was not able to sleep. Her body is not going into that rest phase. Generally, as we can see, the whatever the clinical conditions that we suffer from, the clinical signs and symptoms generally arise, or you can say evoke, whenever the healing phase of this particular the whole fiasco or the episode that starts, or maybe you can call it as a paroxysm, we see these symptoms only then. But here in this patient, whenever she is exhausted, she's trying to sleep and she's trying to rest, she's not able to do that. So she's having anxiety about her health because she's not able to sleep as well, she's not able to rest as well, she's not able to get any relief or particular help for this particular condition. So I thought that the acute flare up that she was mentioning about is generally due to the severe stiffness after emotional shock. Now, I would like to say in this particular case that there was severe stiffness in this patient as she was complaining about the rest of the things. I gave her first as an initial remedy that Calcarea carbonica 200C was given. Later on, she came back with again a very dramatic results. But in the meanwhile, in the period of time, she stopped coming. And I was like, okay, maybe she's better. And generally, this is what patients do. Whenever they get better, they never visit back the doctor again. So that is the reason why I thought that this is one of the thing that we get to see on a daily basis. So maybe that is the reason why she's not visiting. But soon after that, within 2-3 years, she comes back to me again, calling me saying that, are you available? Then I said that I had already packed and parceled myself from that place. So I'm not available. So she was like, is it okay if I call you and talk to you regarding some of the things that I'm going through? So I was like, okay. And then she continued with her saga. And that is when I understood certain things about her and about that emotional shock that I have mentioned over there, which I would not like to bore you with because I have taken an acute totality into consideration. So I would like to only consider what was given to her in this particular scenario. Later on, the constitutional remedy, that is sulfur 1M, was given after 2-3 years of whatever the trials and tribulations were done. She was not on any other medications. She was not on any other systems that she was taking into consideration. But she came back and then she presented with a different case with a different uh, set of symptoms. That is when I gave her sulfur 1M. But it helped her with the previous complaints as well because it started coming back. So acute prescribing followed by constitutional, it is more deepening and it might evoke what was latent or dormant for a period of time. So always ending up with an antisoric treatment after a period of time helps in certain acute conditions, which is an exacerbation of a chronic condition. Okay. So this is what it is given. As you can see on the right side, sulfur was given 2 years later for a different complaint as a constitutional remedy because the patient came back for follow-up after like 2 years. Let us go to the next case. That is the last master case that I have, which has autoimmune background with acute myalgia flare. The patient profile is suggestive of 31-year-old female with rheumatoid arthritis history. Investigations being done, that is ESR and C-reactive protein was slightly elevated. The symptoms being the tearing pain, worse rest, better by motion, morning stiffness, and restlessness. As you can see, she had the history of autoimmune background, meaning the rheumatoid arthritis that she was complaining about. She had interphalangeal pain in both her palm. When she wakes up in the morning, there is this stiffness, and then there is this restlessness, and that is better by motion and worse at rest, suggestive of Rust-Oxycodendron 200C. Follow up, you can see the pain had reduced from 8 to 2 in the numerical pain rating scale within 10 days. Inflammatory markers improved, which was monitored by me. So the reason why I had given Rust-Oxycodendron mainly was the stiffness and the pain that is tearing type of pain, which is worse by rest and better by motion. So as you can see, up until now, whatever I have taken into consideration, these were the master cases that were kind of interesting to me. So I thought that I'll present them first. According to this particular research study, the overview, I would like to tell you like what I have drawn myself into consideration or a conclusion when all of these cases were taken into consideration is that the study design of this particular research study, which is suggestive of 30 case of DOMS related to myalgia, which was from 18 to 40 years. Some patients were also 55 years of age group in this particular presentation. You could have seen that. Numerical pain rating scale used for the assessment. Wilcoxon sign rank test was done for the statistical analysis. Follow-up was over 2 weeks. Now, the key findings of this particular research study overview, you can see the median pain score before treatment was 6, which is moderate. Median pain score treatment after the treatment is 1.50, which is mild. This is according to the numerical pain rating scale that was taken into consideration. Statistically significant reduction in pain, you can see most prescribed remedies was Rustox and rotagravolins. Now, I'm not saying that whenever there is a patient that is coming to your clinic of prominent myalgia or arthralgia or neuralgia or post-viral, say, neuralgia or arthralgia, I am not saying that you are going to suggest them Rustox and rotagravolins. No, this is not what this overview of this particular study suggests. But whenever in homeopathy we are taking into consideration that we only think that only constitutional remedy, only miasmatic treatment, only chronic conditions if somebody is suffering from, and then we take the entire case with all the history and life space investigation and the mental state of the patient and everything, and then you suggest them of a constitutional remedy, only then it will work. No, I wanted to not stick myself to that particular criterion. I wanted to say that homeopathy can also act on acute cases, on emergency conditions where you can see that all these sports runners, they don't have time, that they have to go back to their regular exercise within like hours and within like days. They do not have time to take 15 days of treatment, 1 month of treatment. They will just go to the what is that pharmacy and get a tablet which is like a painkiller, and then they, or maybe NSAIDs or whatever, and that will make them feel better within hours, and then they are back to practice. They don't have time to take homeopathic medications where they are like okay with taking this medications once in 15 days and suddenly come back to your clinic for the follow-up, and then they are like, okay, homeopathy also works. They don't have the patience. I need to, I, during this particular case study, had to keep a lot of patience with me, but also sir helped me with a lot of cases as well. So I had given them these medications, and it worked wonders on these cases because it was a perfect simillimum that suits that particular case, patient. So very important for us to know is that 96.67% of patients reduced to mild pain category from whatever that is suggestive of that. Now this is the rest of the cases. Ma'am, do we have time to present more cases or is it enough? Because I have 30 more cases. Can you hear me, ma'am?
Yes, sir.
Yeah, so can I continue with the presentation or is it enough or just show the master chart and finish the presentation, or is it okay? Time permits to present few more cases, or is it okay if I move on?
Sir, as you wish, as we have attendees still there, and we are interested in joining for few more cases if you wish.
Okay.
So yes, sir, please
Okay.
continue.
Yeah, I'll just go with few more cases, not much, like
Yeah,
two, three
yeah, sure.
cases I'll go on. I'll not bore everyone with all these cases. But then it is, since you are showing interest, I would like to present. But this is the master chart, as you can see over here, which is suggestive of whatever cases that has been presented. Up until now, I had taken 30 cases into consideration. As you can see on the master chart, uh, this is just 10 cases. In the rest of the master chart, I have other cases that I have mentioned in this particular, you know, case study. So here you can see graphitis, Pygelia, Rustox, Ruta, Graveolens, Rustox, Ruta, Graveolens, Puja has been given in the first prescription. Most of the times you can get to see Rustox as the one that is doing the wonder. And as you can see, after like the fourth or fifth follow-up in majority of the cases, it has come down to the numerical pain rating scale has come down to moderate, that is 4, 3, 1, which is mild in number. Okay, this is the next master chart. You can see again Ruta, Arnica, Rustox, Velisperinus, Ruta graveolens, MAC for 6X. This is that case that I had taken into consideration. Semicifuga, sanguinaria, Rustox again, Gelsemium 200. Most of the cases in this particular master chart, you can see that they have not even gone till fifth follow-up. They were better by fourth follow-up itself. So you can see the numerical pain rating scale is suggestive of the mildness of pain. From severity, it came back to mild pain. So next master chart, again, another 10 cases you can see here: Bryonia, Heparsul, Ferretrum album, Alumina, Opium, Diascorea, Ranunculus, Podophyllum, Eucalyptus, Drosera. Now, a set of medicines over here is a little bit vary, but majority of the uh, sy- symptoms that are taken into consideration, or the remedies that are taken into consideration, majorly in this particular case study were Ruta graveolens and Rustox. So the pain had reduced from 8 to 2, which is a very dramatic scale drop when it comes to the matter of pain sensitization in patient. Okay, so this is the master chart. Now I will go further with the rest of the cases. The case one, which is the 19-year-old male. Oh, that is the same case that was already presented. I will present it. I will present another case over here. Okay. Majority of the patients that were enrolled were students, because these were physical education students in Bharati Vidyapeeth. So I had taken these people into consideration. 21-year-old female who is unmarried, who is a student, came with a presenting complaint of pain and stiffness in the wrists. There is stitching type of pain, then the pain in the bones and great ankles as well. Analysis of the case, common symptoms that were taken into consideration were pain and stiffness in the wrists, pain in the bone and great ankles, stitching type of pain, and the uncommon symptoms pain. It aggravated when she was lying down, which was very characteristic feature. Generally, whenever you are having myalgia or any pain, it is suggestive. We say that okay, go and take rest, you lie down, you'll feel better. But when she used to lie down, she's not feeling better. So next is it is aggravating by taking cold, which is again uncommon, and then it is aggravated by wet weather. Now, is this suggestive of something to you all, or which is the remedy that can be given to this particular patient? After evaluation, we got to know that there is pain and stiffness in the wrists, which is 3 plus, pain in the bones and great ankles, which is 3 plus again, stitching type of pain, which is 2 plus, lying down aggravation, which is 1 plus, from cold, there is aggravation, which is 1 plus again. So from the wet weather, there is again aggravation, which is 1 plus. So totality of symptoms you can see all of these symptoms. Then the medicine that was given was Ruta 200. Okay. So when this was given, the reasons to select was legs feel stiff, hips and stiffness in wrists as well, aching type of pain. The rubrics that were taken into consideration were extremities, pain, wrist, extremities, stiffness, wrist, cold weather, extremities, pain, wrist. So this was the rubrics that was taken into consideration in this particular case. Now let us pass on to the next case. That is a 21-year-old female came with the complaint of muscular soreness, pricking type of pain, soreness of great joints. Great joints meaning what? Weight bearing joints, that is knee joints. Okay. So analysis of this particular case, you can see the common symptoms being the muscular soreness, soreness of joints, pricking type of pain in knee joints. Then there is uncommon symptoms being itching on back and flexor surface of thigh, as I told you, which connects to the knee joint. So the lying on the left side, there is aggravation. Then there is aggravation by cold bath. Cold bath. Now again, bath, when we say, what do we mean by bath? Not us taking bath when we say bath. It is showering. But when it comes to the matter of bathing here, it means that lying down in cold water or lying down in hot water. You can see we do generally bathtubs and everything if the patient is having, and they're telling that suggestive of that particular thing, that when I lie down like this, only then I'm having pain, which was suggestive of this particular remedy that has been taken into consideration. I considered her mentals as well because she was extremely irritable when she came to the OPD, and she by herself told that I'm a very jealous person, I'm a very suspicious person, which is very rare for a person to talk about their own negative zones of their mentals. The evaluation and gradation of this particular symptoms has been done. Then the medicine that was given was Belisperinus 200. Okay. Reasons to select was soreness of joints, pricking type of pain, itching on back and flexor surface of the thigh as well, aggravation on the left side by lying on the left side, and then by cold bath. The rubrics taken into consideration was extremities sprain and extremities pain. Now, why sprain all of a sudden that I've taken? I've not even mentioned it in the case, and suddenly I've taken it into consideration is because of the fact that sprain is generally caused by the spasm of the muscle, and which causes the aching type of pain. Aching type of pain means what? Pain and ache has a different meaning. You can see that in dictionary, and then you can find out what is the reason why that has been taken into consideration. Next rubric was extremities pain. So these were the rubrics that I had taken into consideration. I got Belisperinus as the remedy. 200 was the potency that was given. Next case is 18-year-old female who came with a presenting complaint of feeling loss of power, pain in muscles of arms. Now, whenever I'm taking these into consideration, you need to understand that here the analysis of case was being done on the basis of common and uncommon symptoms. Feeling loss of power, when I say feeling loss of power, meaning what? When the patient is not able to grip the hand or being not able to pull or go against the what we say resistance, that is when we say the loss of power, the muscular tonicity has reduced. But the patient is 18-year-old female. How come there is this possibility that the person is having feeling loss of power? Feeling loss of power meaning the person feels that there is loss of power. It is not actually that is happening when it comes to the matter of pathophysiology, which is suggestive of this particular condition. There is no pathophysiological background to this 18-year-old female. She feels that there is loss of power. She is not able to grab or grasp onto things. That is the reason why she complains of pain in muscles of arms. The uncommon symptoms being the pain that is aggravated by the damp weather, by extension, and then amelioration by bending forward. Now, what is this suggestive of? We all know what is this suggestive of? But then we considered, I have also considered the mentals into consideration. The patient was extremely irritable again. Now, I would like to say, why am I only taking irritability into consideration? Is because whenever the patient comes to you complaining about anything, their expression, the way they express themselves, the way they complain about their presenting complaints is extremely important. This is suggestive of a lot of things. So, irritability, anger, anger with indignation, anger with contradiction, all these are the different criterions where you can see where you can put this person into what category. So, anger starts with irritability, then anger, then violence. This is how it progresses further. So, we need to take that part into consideration. Why these youngsters that are coming with these kinds of trivial symptoms are very irritable about their conditions. First, maybe because of the generation that they are in, they want everything like quick and fast, and they want to get relieved of the symptoms that they are suffering from. And suddenly, as soon as I give them medication, within half an hour it should go, it should disappear. Which is what their expectation was, which is what was the biggest challenge for me while giving medications for these patients, because of the fact that they want quick relief, instant relief. So that is the reason why I take this into consideration. And while expressing herself these cases, she was extremely nervous and anxious. I asked her the reason. She was like, okay, the fact that it is very intimidating for me to meet somebody and tell about my complaints by myself. So I generally visit the doctors with my mother. Now that I trust you, I come here and I present my case in front of you. That is the reason why I'm extremely nervous and anxious. I was like, thank you so much for trusting me first, because the fidelity in the doctor is extremely important. The faith in the doctor, faith in the system, the faith in the medicine that we take is extremely important amongst the patient, which we do not see amongst most of the people because they do not trust homeopathy. But I think after this presentation, or after this medicines that has been given, after this particular maybe dissertation that was published in 2 international journals, people that might have given it a read might be able to believe homeopathy, and might be able to believe homeopathic physicians when it comes to the matter of acute prescriptions as well. So that was my main motto when it comes to the matter of homeopathy and sports medicine. So that is the reason why I took this particular topic, and that is the reason why I've been given this medications into consideration. Next is the remedy that was given to this particular lady was Gelsemium 200. The reasons to select is feeling of loss of power 3 plus, pain muscles of arms being 2 plus, and then pain which is aggravated due to damp weather, which is aggravated again due to extension, is 2 plus. So then bending forward amelioration is there, which is 1 plus. The rubrics taken into consideration were generals, pain, cramping muscles, extremities, cramps, hand. This was taken into consideration. That is the reason why I had given Gelsemium 200. Again, the nervousness, the anxiety also was taken into consideration. Always remember, just because the patient comes to you for an acute prescription, they don't come with the acute prescription written on their forehead. You will have to do that as a physician. And what you need to take into consideration is up to you. Just because you're taking acute case doesn't mean that you need not take mental generals or mental symptoms into consideration. You should always see what patient requires and what patient is explaining. Always check for the most annoying symptoms, and what they're expressing, how they're expressing is very important. Just because you're taking acute case doesn't mean that you neglect mental generals from the criterion. Never do that just because you are taking acute case or acute totality. First of all, do not fixate yourself that you're going to draw this as an acute totality or acute case. It develops eventually when you start talking to the patient. So taking time of 5 minutes away of your schedule for a patient for their betterment is very important as a physician or as a homeopathic physician. Next case is a 21-year-old male who came with the pain in the left hip joint, excessive pain after running. especially on bony areas. See, whenever you're taking the chief complaints, I've also told my students as well, whenever they are there in the clinical setups, that always take chief complaints in the language what patient explains to you. Never take it in the medical language that you have been trained in, which is very important because you're documenting that and it becomes a valid medical legal evidence for you that you have taken the patient into consideration and whatever the medicines you are going to prescribe is exactly on the basis of patient's words. So this does not sway you away from what medicine that has to be taken into consideration. The analysis of case has been done on the basis of common and uncommon symptoms, common symptoms being pain in the joint, excessive pain after running. Obviously, after running, there'll be pain. So this is delayed onset muscle soreness. Delayed onset muscle soreness, as the name suggests it starts within the patient after a period of time when they are resting, especially after the regular rigorous exercise or what they are doing on a daily basis. Next, uncommon symptoms being especially on bony areas, what the patient told. See, this is the reason why the particular symptom that you are taking, which is uncommon to the patient or to the disease, is very important. That is the reason why you need to record these symptoms exactly in the patient's words. That helps you in selecting the remedy many of the times. Many other times you may not be able to gather whatever the symptom or remedy that is. But when you look back into the case documents, you will find out that the patient has explained it in a certain way and expressed it in a certain way, which becomes a proactive force for you to drive yourself towards the remedy to pick the most perfect simillimum that is suggestive to this patient. So always record what the patient says in their own language. So for that, you need to know their language. So you need to be multilinguistic, like Dr. Samuel Hahnemann. So here, uncommon symptom being the worseness or aggravation from the right side and due to motion. Now, this is suggestive. Again, I taken mental into consideration, the stress and anxiety about future. Now, this is a 21-year-old male who thinks about his future is very common. There is nothing uncommon about it. But then it should be, fear and not anxiety. Anxiety is something that is grade 2 of fear, like, so that is the reason why you don't know what is going to happen. You are fearing that particular possibility because you don't know what is going to happen. That is anxiety for us. So that is why I have taken anxiety about future into consideration. Had done gradation and analysis and evaluation. After all of that, I came into the totality of symptoms. The medicine that was prescribed was Alumina 200. The pain in the joint was taken into consideration, excessive pain after running, especially on the bony areas, aggravation on the right side, aggravation due to motion. The rubrics that were taken into consideration were extremities pain, hip left, extremities pain, upper limbs right. So these were the rubrics that were taken into consideration. Next case is the 19-year-old male who came with a presenting complaint of painful joints on both limbs, feeling of tearing down sensation in thighs. What is tearing down sensation in thighs? How could somebody have tearing down sensation in thighs? Tearing means what? Tearing of a paper, tearing of a joint, tearing of a muscle. How is that even possible? Can a muscle tear? Yes, but only when there is a rigorous exercise which is done on a regular basis, but not regularly done by the patient, because the patient had taken a break for a time being and like he is back to his routine workouts. Now, technically, this is why the muscle gives up, because when you have devoid yourself from the physical exercise and the practice of doing it on a daily basis, your muscle kind of forgets the fact that you are into this. The muscle memory doesn't help you in regaining what you were going through before you were into the practice. So that is the reason why the majority of times you will see in sports runners, marathon runners, in sports people, that you will get to see this particular symptom they explain that I am not able to walk. There is a tearing type of pain. So which was taken into consideration as it is explained by the patient. The analysis of the case has been done on the basis of common and uncommon symptoms. Common symptoms being painful joints on both limbs, feeling of tearing down sensation in thighs. Uncommon symptoms being tenderness about knee joints, which is aggravated by the rest, ameliorated by the continuous motion, and then mental generals has been taken into consideration again, because as I told you, this generation is, I would not like to blame this generation, as I also belong to this generation, but then at the same time we have to take this into consideration as physicians. So that is the reason why I thought the irritability with which the patient was explaining to me was to be taken into consideration and never ignored how their expressions are. So yeah, this is the same case that I told you. So the painful joints on both the limbs, all of this has been taken into consideration. Finally, Rustox has been given to this patient as a remedy. Reasons to select was feeling of tearing down sensation in thighs. There is tenderness, and about knee joints. What is tenderness? Whenever we are taking tenderness into consideration, what tenderness actually means? Pain is, like we know pain. What is pain? But tenderness is extreme sensitivity to even touch, the hypersensitivity over that particular region, which is localized. The pain is localized to this particular region, and you're not able to touch that part. You're that tender. So, meaning your sensitivity towards pain, sensitivity towards touch, is because of the pain that is 3+ grades above. So the severity of the pain is so much so that you're not able to touch that particular part. Now, the aggravation due to rest and amelioration due to continuous motion is the reason why I have given Rustox 200. The rubrics that were selected were extremities inflammation joints, extremities pain joints, extremities pain sore bruise. These were the rubrics that were taken into consideration. There are many other cases which I would gladly present to all the students over here and all the homeopaths if they have joined. But I would like to give you an overview of whatever the case that you can see on the screen right now. The case one was of a 19-year-old with the severe calf stiffness. The case two was of 21-year-old female shoulder soreness after gym workout. The case three was 23-year-old female quadriceps pain after marathon training. Stitching pain aggravated by movement, ameliorated by firm pressure. Irritable disposition, remedy was given, that was Bryonia alba. Case 4 was 18-year-old female generalized body ache after sports camp. Cramping pain, which was ameliorated by warmth and pressure. Remedy that was given was magnesia phosphorica. Case 5 was 20-year-old male, forearm strain from weightlifting, tendon soreness, aggravated by exertion, ameliorated by rest. Remedy given was rutagraviolens. Case 6 was 22-year-old female with trapezius myalgia from posture strain, dull aching, aggravation in the morning, amelioration by stretching. Remedy that was given was rustoxicodendron. Case 7 was 17-year-old male, severe thigh pain after sprint drills, burning soreness with the stiffness, amelioration by hot bath. Remedy that was given was rustoxicodendron. Case 8, 24-year-old female, hamstring stiffness, post-yoga overexertion, pain that was aggravated by sudden movement, ameliorated by gentle motion. Remedy that was given was rustoxicodendron. Case 9 was 19-year-old female, ankle and calf strain after trekking, ligament soreness aggravated by pressure. Remedy that was given by rutagraviolens. Case 10, 23-year-old female, upper limb myalgia after resistance training, aching type of pain, aggravated by motion, ameliorated by rest. Remedy that was given was Bryonia alba. Now, case number 11, 21-year-old male, back stiffness after gym squats, restless, changes position frequently. Remedy that was given was rustoxicodendron. Case 12, 20-year-old female, calf cramps after dehydration, spasmodic pain, amelioration by warmth, amelioration by pressure. Remedy that was given by was magnesia phosphorica. Case 13, 22-year-old male, deltoid soreness post-cricket match, pain aggravation by cold air, amelioration by heat. Remedy that was given was rastoxicodendron. Case 14, 18-year-old female, bilateral thigh ache post-sports drill, general weakness with stiffness. Remedy rastoxicodendron that was given. Case 15, 23-year-old male, severe hamstring stiffness after long cycling, better continued by motion. Remedy rastoxicodendron. So, case Seracera, we have definitely the amount of symptoms that have been given. So, these are the 30 cases you can see. The key takeaways from this particular presentation was the myalgia is multifactorial and requires holistic evaluation. Acute totality ensures precise homeopathic prescribing. Research evidence supports measurable pain reduction. Remedy must follow symptom evolution. Individualization remains the core strength of homeopathy. Now, as I already told you, these are my articles that has been published in Scopus indexed journals. You can see the links below, the review articles and the research articles that has been published in biomedical journals, African biomedical journals. It is a Scopus indexed international journal. You can see it now under my name. You can go type it in Google and find out these particular links. You can read these articles as well. I would be extremely obliged if you would do so. So yeah, this was the presentation regarding role of homeopathy in the treatment of myalgia. My aim being acute totality, which was never being focused up until the times immemorial. But then I would think that homeopathy also works in emergency conditions. Homeopathy also works in acute conditions, which was proven by, I guess, by this presentation and also the number of cases that has been proven, which was all a wonderful success, a thumping success, but at the same time, 6 master cases that I had selected, which worked majorly, which had a dramatic response to the medicines that I had given. So I would like to thank Homeopathy 360, Homeo Bridge, for giving me this opportunity to present this presentation, which I selected some of the cases from my own dissertation. The reason I had already suggested in the beginning. I would like to thank our cultural president from our college, Dr. Anupama Deshmukh, for helping me out throughout the case. I would like to thank my student Aditya, who helped me with most of the presentation work and everything. So I would like to thank everyone on the panel and the moderator and Dr. Meenakshi as well, my final year student, who gave a wonderful and a brief and a beautiful introduction regarding me. Thank you so much. Thank you everyone for joining. Thank you all the audiences. And thank you everyone for being here patiently, even though saturation level plus went on beyond. Because it started late, it ended late. So thank you so much for being patient throughout the presentation. Thank you.
Sir, there is a question by Dr.
Yes.
Y.N. Rao.
Mhm.
He asks, could myalgia, cramp, and neuralgia be taken as synonyms to each other based on the similarity of certain symptoms? If
It
not, what are
differs.
the...
Okay.
Uh-huh.
It differs. It depends on the case. See, whenever you are taking the, I never mentioned, whenever I'm explaining regarding the case, it to be the synonyms of each other. Whenever we are considering these symptoms, arthralgia, neuralgia, the name itself is suggestive of what is the problematic areas. Myalgia itself talks about generalized body ache, and it is not suggestive of one particular part or something like that. When the patient suggests you there is myalgia, but this particular part has localized pain more, and the patient explains regarding what is the type of pain, being the pricking type of pain, the burning type of pain, the aching type of pain, whatsoever, depending upon the patient's description, we can solidify the evidences with the help of investigations and clinical signs and symptoms, that what is the diagnosis of this particular condition. But according to classical homeopathy, if you are keen in following, Hahnemann never suggests of diagnosing a particular disease. He always suggests us to diagnose the person. We treat the person as a whole. So, here, since it is suggestive of me to take a particular topic, I took myalgia because of the fact that it concludes with all over the generalized body pain. It could be any part of the body. So I did not wanted to keep myself devoid of a particular part. If I say knee joint pain, if I say shoulder joint pain, if I say any other part of the body, I would be keeping myself off the limits where I cannot touch the rest of the parts of the body. So I did not wanted to keep that as a backdrop for my research work. So I have taken myalgia into consideration. It doesn't mean that we have to use these words that you have mentioned here as the synonyms of each other. Okay, I hope this answered your question. It was a brilliant question asked by whosoever it is. Thank you so much for asking the question.
Sir, there is another question by Dr.
Yes.
Ashok.
Hmm.
Doctor, how you can advise for long-lasting pain after a fall on a road accident?
The question is not very clear. Could you please repeat that?
How can you advise for long-lasting pain after a fall on a road accident?
Okay. The case has to be taken into consideration. Onto what is the history, when was the fall, how it took place, where is the pain localized to, how long it has been. All of these things, we being homeopaths, you know how the case taking has to be done. It has to be done accordingly. So I can suggest accordingly to whatever, wherever the region of pain is. I cannot just abruptly suggest you to do this or that. What I can suggest you as of now is to visit some OPD, some homeopathic OPD, preferably mine, and then you can come and give your case, and then I can suggest you the remedy, and hopefully after the remedy you feel better. Thank you. Are there any other questions?
No, sir.
Okay. Thank you so much. Those were very good questions relevant to the topic, which was suggestive of. So thank you so much for making me be a part of this wonderful presentation, a webinar gathering where all of these students are here to listen to whatever the topic was. So thank you so much, the panelists and Homeopathy 360.
Thank you so much, sir, for giving us your valuable time for this
Yes,
wonderful presentation. And no doubt we have learned so much today. So a big thank
sure.
to you.
Hopefully. Yeah,
Thank you so much, sir. And this session will be very soon available on the YouTube of Homeopathy 360, where
sure.
students and physicians can rewatch this amazing session.
Okay, ma'am. Thank you so much.
Thank you so much.
Thank you.